It's Black History Month. So I just want to welcome everyone to this wonderful celebration and community dialogue that we're going to be happening during Black History Month. And it's called Honoring Our Heritage, Protecting Our Future, and Celebrating Our Black History. And this is a community dialogue series to really talk about something that's important to everyone, which is COVID-19 and protecting ourselves during that period. So my name is Milam. I'm Crime Prevention Manager with the Richmond Police Department. And you may also know me because I've done work on the COVID-19 public information team for the city of Richmond. And this is a special series because it's a partnership between Contra Costa Health Services and the African American COVID-19 Working Group, community organizations. We're partnering with the city of Richmond and with crime prevention to talk about something that's really important to our communities. The goal of this series really is to connect and to promote COVID-19 prevention, safety, and a sense of collective responsibility using some spiritual insight and focusing on some of the principles of Kwanzaa, like Ujima. So for those of you who don't know what Ujima is our collective responsibility to protect each other from COVID-19. And so we've had a couple of guests, and today I'm very proud and honored to have a special guest, which is Dr. Sonia Sutherland, who's going to introduce herself and tell you a little bit about herself.
Thank you, Michelle. I'm excited to be here and honored to participate. This is a great program. I am an internal medicine trained physician. I work for Contra Costa Health Services. I am the medical director for quality and safety. I see patients in the hospital. I see patients in the ambulatory clinics, and I work in leadership to make sure that when patients come under our care, their experience is exceptional and they receive high quality and safe care.
Wow. Well, first of all, I want to say thank you for your service. Because you're obviously doing a great service for our community, doing and putting in all that work, helping us through this time.
Thank you.
So, our whole lives have changed within the blink of an eye. We've really been living with this for months now. So how has COVID-19 impacted you?
Definitely had an impact. And I guess for me, if I were to sum it up in one word, I would say pause. I feel that, the whole world has paused. We didn't stop, but we have definitely had a big pause now for almost a year. And with that, out of that pause, I think there's been good and then there's been bad. I mean, the obvious thing is, that we wish hadn't happened: illness, death, suffering, economic loss, all the things that the illness and the pandemic and COVID-19 has brought. But on the flip side, the good things that have happened, I feel, especially for the African American community, our staple has been the Black family and the Black church. And I was just thinking a year ago, we are running in 5 different directions: work, activities, entertainment. We spend more time texting people than talking to people. And so out of this pandemic and really kind of slowing down and pausing, I feel that it has really enhanced our community, the Black family, the Black church, all the things that were our strength. And just being able to spend time talking to one another at home and, slowing down and appreciating all the great things that we have: life, health, and being grateful for what we have.
Wow. And you really hit upon a really important point about coming together as a community. As we're thinking about it in the context of Ujima, which is our collective work and responsibility, how have you used that principle of Ujima to protect our community during this pandemic, where you said there's, just so many things that are happening, good and bad, that we're all experiencing? And how are you going to carry that principle of Ujima into the new year?
I love it. Well, I would say, just starting with me as an individual, when I put on a mask, when I wash my hands, when I'm socially distant, then I'm doing my part as an individual. So if we all do our part as individuals, that, obviously helps our community as a whole. The other thing that I've done for collective responsibility, as a physician, one, in interacting with the individual patient I might be seeing that day, is making sure they're aware of, how to protect themselves with COVID, keeping them healthy, and also explaining and talking about the vaccine, especially now, really trying to help people to understand that and to be prepared to be vaccinated. As part of the greater, beyond the individual patient, just being a resource to community groups, church groups. I've been on some panels talking about COVID-19, talking about the vaccine, and just making sure that they see people that, look like them, that are here to give, medical facts and to share the science. And so I've been participating in that, and, that's been great. And then just within my own family and, circle of friends, sharing and supporting, when people call, if relatives have had to go to the hospital or anything, just, being that support and helping them as well.
Wow, I really appreciate all the things that you mentioned, because I think that these are conversations that we're all trying to have with each other. And you hit upon a very important point about the vaccine that I wanted to talk a little bit more about, and information in general about COVID-19. So there's a lot of different sources of COVID-19 information that are floating out around here. And information about the vaccine. So what are your sources of information that you trust?
Well, I have to go with the scientists and the medical experts, both nationally and as well locally. Here at Contra Costa Health Services, from the very beginning, we started sharing information, within the physician groups, all of the healthcare providers. So we understood, we, looked at the research, looked at the information, shared about which treatments to be used, which isn't working, what isn't working. And so that's been a great source, locally, as well as, the national, the experts that are presenting and sharing. And then many of the physician organizations, as well, emails, just a lot of information has been shared that's trustworthy.
And I think that's definitely great advice, to take a look at some of the stuff that's going on in the science community. And you've given us a few different sources that we can look into. So, when we talk again about the vaccine, will you take the COVID vaccine when it's available? And what is it that would inform that choice for you?
Well, I have taken the COVID vaccine, both shots. And for me, I was one of the members of the first group to receive the vaccine here in Contra Costa Health Services. And I was happy to get in line and to be a part of that first group. You know, I understand that people may be, hear things, concerned, fearful. I understand all of that, but we have to look at the science. And these vaccines are 97% effective. They've been researched. I could go on and on about some of the science, but the thing that I guess I would say is definitely, none of us want to suffer or to be ill. Here's prevention. And part of my whole medical career has been talking about staying healthy, staying well, doing things to keep our bodies in shape to prevent disease. So why wouldn't you take a vaccine? Why wouldn't you want to be in line to say this works? It's been studied, and it wasn't something Johnny come lately. They had already been preparing with the SARS. And again, we could go on and on about the science. So for me, I think we should all be vaccinated, to prevent the spread of this disease and to keep ourselves and our family and our friends and our coworkers and the people in the grocery store, collectively, our responsibility to keep people safe.
I really think that that's, such an important point, especially because, a lot of people are going to their personal physicians to get, information. So I think, just being able to have this conversation with you is really important. So, because this is the kind of conversation people are going to be having, over the next couple of months. It's really to get people starting to think about this. And it definitely helps me think about this as well. So I really appreciate you and honor you for the time that you spent with us, Dr. Sutherland. And I just, thank you for being a part of this conversation. I think it's such an important one to continue to have. And, as we kind of think about this closing out Ujima, is our collective responsibility to protect each other from COVID-19. We got to continue to have the discussion with each other, especially in our communities that are really hard hit by this COVID-19 disease. So for everybody who's out there, who's watching this, we want to hear from you. How are you having these conversations with your family members, with your friends, with your church members, with people who are in the community? And we want to hear about it. We even have a hashtag line, so it's called Flatten and Flourish. You can post your stories, your thoughts, your pictures. We just really want to hear from you so that we can share this information and continue to have this community dialogue. And you can also check out some questions and get informed from information on the Contra Costa County Health Services website if you have more questions about things that we talked about today, or you want to do a little bit more research. So we really appreciate you all for being a part of this conversation today. I'm very honored to be a part of the conversation. And as I sign off, just want to remind everybody to wear your mask and show love from a distance.
Thank you. Sounds great.